Throughout history, medicine has changed and adapted to accommodate new discoveries, population needs, and sometimes shifts in societal norms. We see this happening in real time today, particularly as it relates to healthcare trends. Now, if you're a regular MedBoard Pulse listener, you know we've talked about a couple trends on the show: IV hydration clinics and GLP-1 drugs to be specific. Today's topic is another one that has been discussed at length by the board members. Maybe you're familiar with it, or maybe it's new to you. Either way, I've invited a special guest to tell us all about ketamine. I hope the suspense is getting to you. Listen in. You're listening to MedBoard Pulse, a podcast by the State Medical Board of Ohio. I'm your host, Jerica Kent, Chief of Communications. Let's talk, Ohio. Thank you for tuning in today. As I mentioned before the intro, today's discussion topic is ketamine. I'll be the first to admit, before this past year, I had probably only heard of ketamine a handful of times. I didn't know what it was or what it could be used for in clinical settings, but I'll tell you what changed that for me. The board developed its Emerging Practice Trends Committee, which spends time discussing and understanding trends emerging in healthcare and how they intersect with our regulation and legislation. Over this past year, the board took a good hard look at the use of ketamine. And they found some interesting things. I'll just get into the basics because I like to save the real explanation for our guests. But for starters, ketamine is a drug, and lately it seems to be popping up in all kinds of places. With just a simple Google search, I immediately located 5 businesses in the greater Columbus area and another 9 in other parts of Ohio, every single one identified as a mental health clinic. I do want to premise this conversation by saying at this moment in time, the board does not have rules that specifically address ketamine, but it is the responsibility of the board to properly regulate physicians, physician assistants, and the other healthcare professionals in the field, all in support of patient safety. And that's why we're talking about ketamine today. We know that it's becoming more popular, and we feel a responsibility to educate the public and our licensees. And for that conversation, I knew exactly who I had to speak with. Very shortly, you'll hear a conversation with one of our esteemed board members, Dr. Amol Soin. He is a pain management specialist, board certified in anesthesiology, pain medicine, and interventional pain management. Dr. Soin practices in the Dayton, Ohio area, and so we scheduled time for a call to tackle the subject. And man, did I learn a lot. Dr. Soin, can you please introduce yourself and briefly describe your background and specialty?
Yeah, sure. My name is Amol Soin. I grew up in southwestern Ohio near the Dayton area. I went to elementary school and high school in Beaver Creek, and then I went to medical school at the University of Akron and Northeastern Ohio Medical Universities. After that, I graduated and went to Chicago, and I did residency in anesthesiology at Rush, and then went back to the Cleveland Clinic and did a pain management fellowship. A lifelong learner. Over my career, have accumulated a lot of college degrees. I have 5 college degrees, actually. My undergraduate degree, my medical school, I have 2 master's in science degrees from Ivy League schools, Dartmouth and Brown, and I have a master's of business administration as well. I've opened up a private practice in southwestern Ohio where I serve my community there in the Dayton region and have been since around 2007. And so now just actively in private practice.
I did not know all of that. So
Oh,
thank you for helping me learn some more about you today. How long have you served on the medical board?
13 years so far. So I've been on the board for 3 terms. I've also had the privilege of serving on the Medical Marijuana Commission for the state as well, which was an interesting process.
Absolutely. I know we have one of those meetings coming up this month. What do you like about serving in this way, especially considering your background and clearly seems like you have a passion for learning and for making sure that you're serving your community.
Yeah, well, serving on the medical board has been just a great honor and a privilege. And being in pain management and from Dayton, Ohio, we really struggled with the opioid crisis. And I think almost everyone I know was touched by it in some way, either directly knowing somebody or being a friend of a friend of somebody that struggled with opioid addiction, overdose, that kind of stuff. And there was a while where I felt like pain management and the way we were managing pain was responsible for portions of that crisis. And being a pain management physician myself and understanding the crisis, I really wanted to have an opportunity to provide my insights and views on how we can best get out of it and how we can maintain access to care while still preventing a lot of this abuse and diversion of medications. And that's what really sparked my interest to serve. And now I've been doing it for the last 13 years, and I'm just so grateful for the opportunity to be able to do that.
Well, thank you. We're going to transition then. I want to talk about ketamine today because my understanding is you have a lot of knowledge and expertise in ketamine. So, my first question is, can you explain to the listeners what is ketamine?
Yeah, so ketamine is an anesthetic agent that we use primarily for anesthesia. It's an older medicine. It's been around for several decades. And it is an interesting medicine because a lot of the anesthetic agents that we use depress or decrease your breathing. But ketamine doesn't do that, actually. It helps stimulate, in some cases, you to breathe, which has a lot of utility for it. It is actually a very potent medication for pain as
Mm-hmm.
well when you give it intravenously. And we're also learning that it has a tremendous amount of beneficial effects for people suffering from psychiatric diseases, in particular depression. Treatment resistant depression, ketamine has almost been life saving for some people. A lot of people are familiar with ketamine and they refer to it as like a horse tranquilizer because it is used in the veterinary uses quite a bit. If you have a pet that gets neutered or spayed, um, what they do for anesthesia oftentimes is a ketamine infusion. If you've seen some nature TV shows and you see that dart gun where they shoot an elephant and it falls
Mm-hmm.
over and goes to sleep, but it's still breathing, that's oftentimes a ketamine dart.
Interesting.
Yeah. The other thing that's interesting about ketamine is it's an analog to a drug called PCP or LSD. So it has
Oh,
this
I think we've
sort of
heard of that.
yeah, it has this sort of like trippy effect
Hmm.
for people that take it. As a result, some people actually abuse ketamine for that reason to experience that sort of, trippiness, so to speak.
We're just getting started with this topic, and I promise it's fascinating. You don't want to miss this conversation. We'll be right back after a brief break.
Hi, I'm Nick. I'm getting married today.
You may now kiss the bride.
I'm also a firefighter and first responder. When you move over and slow down, you're not only giving me room to work, you're also making sure I can get to my wedding ceremony to start the next chapter of my life.
Roadside workers have lives and families, but when they're on the job, they put it all on the line to protect and serve us. Let's all give them room to work. When you see flashing lights, remember, they're not just roadside workers. Thank you for moving over and slowing down.
What happens when a licensee violates Ohio rules or laws and receives a disciplinary action from the board? Transparency is an important aspect of the board's work. When a licensee is disciplined, the board action is published to the board's monthly formal action list and on elicense.ohio.gov. Remember, you can visit eLicense to see the license status and disciplinary history of any board licensee at any time.
Welcome back to the show. In this episode, we're listening in on a conversation I had with physician board member Dr. Amol Soin, and he's explaining ketamine and its uses. Let's take a listen. It's interesting that you say that it's been around for a long time because I've only started hearing about it more recently, and probably more of a trendy circles. And so I was going to ask you what are the most common uses, but you kind of explained that. And I guess my next question would be, what other settings do you find it in commonly then? So I know you said veterinarians may use it, but people use it for pain as well, you said?
Yeah, and interestingly, so we use it. I'm an anesthesiologist as well, and it is just a great tool in anesthesia because it doesn't make you stop breathing. So if someone
Mhm.
needs an MRI scanner and they need, anesthesia for it, sometimes ketamine can be helpful in that scenario because they can keep breathing while they're inside that little tube and then they're still
Mm.
sedated. But we use it for all sorts of anesthetic agents, and that's where it lived for a very long time.
Hmm.
Over time, we discovered that it's actually very, very helpful for depression. This treatment resistant depression, where everything else has failed and nothing is working. And oftentimes, people will get relief for treatment resistant depression for, about 12 weeks or so, which is incredible.
Mm.
It's
Yeah.
actually a great tool for it. And there was some studies done on it recently. I would say recently is in the last decade or so.
Okay.
So to your point, a lot of people didn't really know about ketamine. It just kind of existed just like other anesthesia drugs, and unless you were really into it, you wouldn't even know about it. But when it started getting all this good evidence on depression, it started getting used a lot more. Eventually, a new version of it got FDA approved as a nasal spray for treatment resistant depression. And then it
Mm.
really started expanding. Um, People also started experimenting with ketamine for its use in chronic pain. So, pain where nothing else is working. And a lot of this was born out of the fact that when we started moving away from opioids and narcotics, which, by the way, is a wonderful thing because those medicines had a lot of problems,
Absolutely.
we started looking for alternatives, and ketamine ended up being one of those. And it became a relatively useful tool for people that suffered from severe pain. And that was administered intravenously through an IV, or even orally through lozenges that are compounded and made. There's also some nasal sprays out there that are compounded. It's not actually FDA approved for the use in chronic pain, so it had to be done by compounding pharmacists and that kind of stuff. And so it really, I think, over the last 5 years, coming out of COVID, has really blown up as a therapy. And now I'm seeing ketamine clinics popping up all over the area.
Hmm. In terms of the pain application, are there certain populations we're seeing use it? Is it maybe like vets, or is it, so trying to think of other a particular kind of chronic pain conditions that where we're seeing pockets of people use it heavily for that?
Yes, the most commonly used patient for ketamine is people that suffer from something called neuropathic pain. And that refers to pain that comes from nerves or nerve damage. So if you fall off a ladder and break your leg, you have a lot of pain, but that's mostly from injury to your bone or blood vessels or muscles, and all of that eventually heals over time. The problem is if you have nerve damage or neuropathic pain, sometimes those nerves are damaged and they don't repair themselves. So you are stuck with this chronic pain condition. That nerve keeps firing day after day, year after year, and there really isn't a lot of good treatments for that. So we
Mm.
realized that ketamine can sometimes help those nerves settle down from firing pain signals. So that particular patient, people who suffer from neuropathic pain, in other words, pain from damaged nerves, tend to be responders to it.
Interesting. Does the board have regulation in place to even regulate the use of ketamine to treat pain, like nerve damage kind of pain? Or is it
So it's
kind of a little bit of a gray area?
It is a little bit of a gray area in terms of rules with the medical board. Now, we do have some chronic rules that are helpful and protective for our citizens regarding controlled substances. Now, ketamine is a controlled substance. So, for example, physicians have to check something called ORS, which is a physician drug monitoring program, where we get a profile of the patients and what other drugs that they're on, that are also controlled substances. And that report also gives us a snapshot of the patient in terms of their potential risk for overdose, and it gives a score called a NARC score, just about other narcotics and other things that the patients may be on, and that gives us clues as to whether or not this is might be a problem for the patient. So, for example, if they have a really high overdose score on that scale, that might be something a physician would want to say, hey, we should be careful with this. Now, those are tools available for physicians. The question really is, I think you're asking is there a rule set or legislation in place at the board to sort of police or educate or direct that specifically to ketamine? And to your point, yeah, it is kind of a gray area at this moment. Um, and the one thing to notice is that we've really seen an explosion in ketamine clinics in the state of Ohio, probably for the last 3 years. So this is a relatively new phenomenon.
What are some of the risks that we're seeing then, in particularly at these ketamine clinics? If again, we're
Yeah,
having this really kind of a retail setting, is my understanding. Um,
correct.
what are some of the risks?
Correct. So ketamine is I would consider it to be a dangerous drug. People die from ketamine,
Mm,
and they die from ketamine overdoses in many ways. Some of them are, famous or in the media. So for those who watched the TV show Friends, Matthew Perry,
mhm,
who played the character Chandler Bing, actually died, and the cause of death was related to ketamine toxicity.
yeah.
And that really kind of shined a light on on ketamine nationally. Um, Ketamine has some side effects. Those hallucinations that occur, they can be scary, disruptive to the patient. Sometimes during that period, the patient may lose awareness or not understand what's real and what's not real. And that can be tragic or terrifying for the patient and people around them. Sometimes patients can become violent because they don't even realize what's going on.
Mm,
They might feel threatened because they're hallucinating, even though they may be in a safe space. They could be hallucinating that perhaps something bad is happening or someone's coming for them or something like that, and they might act out, which makes it very very difficult and challenging. Um, and I think that is really something that's hard to police and to understand. So as we're seeing some of these retail clinics rising and coming up, and a lot of people starting to get it, I think there should be some, for the sake of patient safety, for the sake of practitioner safety, there should be some recognition, perhaps, I don't know what term to use, maybe training or more awareness on what can happen. Um, it's important if, say, for example, you're getting ketamine through an IV or something where you're getting a lot of it, to make sure that you're monitored. That you have EKG stickers on your chest to look at your heart rate, that you have an oxygen sensor typically on your finger to check your oxygen percentage, because although it doesn't make you stop breathing, it can affect your breathing if you're
mm,
really, really sedated. So, for example, if you have sleep apnea and you have a lot of ketamine and you fall asleep from it, I mean that could put you in a very deep sleep that might be difficult for you to get enough oxygen. You should also check your heart rate to make sure that's staying stable. Ketamine has this effect where it releases a compound called norepinephrine.
mm,
Norepinephrine causes your heart rate to rise a little bit. So if you already have high blood pressure, or if your heart rate is already a little bit high, or if you have heart disease and you don't want to have a rapid beating heart because that could cause you to have a heart attack or something, ketamine is a very bad choice for you in those scenarios. Or let's say you had artery issues to your head. Some people have clogged arteries going up that way, and that can cause a stroke. So we call that cerebral vascular disease. If you have that and get ketamine, that can increase your chance of having a stroke. These are not, minor side effects. I mean, these are life-altering or perhaps life-ending side effects, which are why I think it's good you're doing this podcast so we have some awareness about it.
absolutely. From the consumer protection side, I guess you just kind of talked about them, the dangers. Who is authorized to administer ketamine in these clinics or in a
It's,
hospital for
it's
that
an
matter?
yeah, it's an interesting thing because the concept of a freestanding ketamine clinic like this is relatively new.
Mm,
Um, and so typically it's done by physician order. However, in some states, including Ohio, where providers such as nurse practitioners and sometimes physician assistants have the ability and legal authority to prescribe a scheduled substance, which they are in Ohio,
mhm,
technically they would have authority to do that as well. Um, a lot of the clinics that I'm seeing pop up, at least in my region in southwestern Ohio, oftentimes it is a nurse practitioner, for example, that might be running or administering the ketamine. As it started, and for many decades until all of this happened recently, it typically was anesthesiologists and nurse anesthetists inside hospital settings that were administering ketamine. Only recently has it really expanded to the outpatient setting.
Interesting.
But it's caused some interesting dynamics for us on the medical board and just for our public at large in terms of safety, especially with the rise of telemedicine that's occurred
Absolutely.
after COVID, right? So I have noticed, and because I talk about ketamine a lot, it actually shows up on my Facebook and my YouTube Reels feed of these different clinics that actually offer mail order ketamine. And when I click them, a lot of times they talk about there's telemedicine doctor, you don't even need to pay a physician live, and it's like a monthly subscription, and it gets mail ordered to your house on your doorstep. Now, in those scenarios, I do worry about that. Um, because if you take too much of it, you could become disinhibited, confused, and that's literally how Matthew Perry from Friends died. I mean, he was doing it at home use. Actually, was in a hot tub, took too much, fell asleep,
Mm.
lost his ability to be aware of where he was, and actually ended up drowning in his hot tub. But ketamine was the root cause of that. And if you are doing that mail order stuff, taking it at home, and it's not monitored and the dose isn't really controlled, I think people can get themselves into some issues. And just imagine, if somebody had mail order ketamine, took some, and then got behind the wheel in a car, and started driving
Absolutely.
around, and all of a sudden they're hallucinating, and they could really hurt other people that are just innocent people driving their own cars trying to get their way to work. And yeah, that's kind of an issue that we
Ab-
probably need to
yeah.
address.
There's so many. I think about if you're watching your kids and then you're having some kind of episode like that, if you could harm your kid. There's so many situations that seem very dangerous for home use. So that would be I just want to go back to the compounding pharmacy piece of it. Would that be by prescription in that particular situation?
Correct. Correct. There
Okay.
is no way to get ketamine without a prescription. You would need a prescription to get it in some form, especially if it's in the outpatient setting. So that would be a doctor or a nurse practitioner or a physician assistant actually writing a prescription and then having that dispensed.
Okay. So even this mail to your home option is technically a prescription, although you're kind of bypassing even normal physician-patient relationship to get it. You'd be
Correct,
checking
correct.
a
I mean,
box.
you're basically doing it as you're seeing with a lot of other things now,
Absolutely.
prescription, these new GLP-1 weight loss agents. There's clinics that are offering, oh, just, we'll meet through Zoom or whatever and talk, and then you get it mail ordered to you.
Interesting. It sounds scary to me, Dr. Soy. I'm not gonna lie. It sounds a little scary to me.
Yeah, and it's all new, and we're just starting to see this stuff, and so we're all learning, right, as this process is happening. The thing is I think all of us are just so apprehensive from the opioid crisis getting away from us so quickly.
Yeah.
Um, we want to make sure that we're ahead of this ketamine issue, not behind it, which is why we're at the board level just being really vigilant about wanting to pay attention to it.
I told you this was interesting stuff. We'll be back to wrap up this conversation after this commercial break.
Did you know the medical board consists of 9 physicians and 3 non-physician consumer members? Our board members are appointed by the Governor of Ohio to serve 5-year terms, and they have the responsibility of determining licensee discipline, adopting new rules and policies, and granting licenses to qualified practitioners. After 130 years of service, the board continues to protect the public through effective medical regulation. Learn more about the board's mission by visiting med.ohio.gov. Click the tab About the Board and select Agency, Mission, and Goals.
You're listening to MedBoard Pulse, a podcast from the State Medical Board of Ohio. In today's episode, we're listening to a conversation with Dr. Soin, and he just finished explaining some of the risks of ketamine. Let's jump back in. You recently contributed to an article in the journal Medical Regulation on this subject matter. What are the concerns about the way ketamine is being used today? Clear, we just talked about this in general, but there were some specific areas within that article.
Yeah, I'd love to talk about it. And there's a couple of issues of concerns. One is it's an area that's so new that it hasn't been regulated yet. And maybe there needs to be a rule set or at least some guidance on just the basic minimum things you should be doing as a physician or as a patient to make sure that you're safe. And I mentioned, having monitors in place, that someone's watching your heart and lungs so that when you're under this, ketamine, that you're safe and protected. That also protects the physician. The versions that are FDA approved actually on their label have specific guidance, such that it can only be administered inside a physician's office, not at home. And that's the one that's FDA approved for depression. And that the patient stays after that infusion or the nasal spray is done, they stay at a minimum for 30 minutes. To make sure that they don't have any symptoms, they don't have any hallucinations, and their blood pressure and everything is stable before they're able to leave the physician office. And if you don't do those things as a physician, you have breached the FDA label. So that's kind of nice. The problem is when you get something compounded, there is no FDA label. It just kind of is the Wild West. You can do whatever you want. Now,
Absolutely.
the 30 minutes is critical because ketamine, if I was to administer it IV, and I've done this a number of times in the hospital, seeing patients, I've given IV push, so you can literally sit there and watch what happens to a patient. But essentially, it has a life once it's in your bloodstream of about 20 minutes. So what that means is after 20 minutes, those effects of hallucinations, disorientation, that whole sort of effect dissipates. And 30 minutes afterwards, after it's entered your bloodstream, it's for the most part gone. I mean, there are some rare scenarios where people's metabolism might be different or something that it could still be there. But I think that's why that FDA label has at a minimum 30-minute delay after administering it to make sure that patient is good to go. Protections like that could be supremely helpful. And I keep going back to Matthew Perry, but imagine if he was supervised for that at least 30 minutes after it was administered. It's within that time frame where you kind of lose control of stuff.
Interesting. Can you, I know in that article as well, you're referring to off-label prescribing. Can you tell our listeners what that means and what we were talking about?
Yes. Yes. So ketamine is on label. By on label, it means it has been studied, it has been reviewed by the FDA, and the FDA has approved it and labeled it as being two things: one, safe, and two, effective, as long as it's being used according to that label. Ketamine is only on label for its use inside a hospital setting for the purposes of anesthesia. And secondly, inside a doctor's office, only for treatment-resistant depression, intranasally, with that monitoring that I mentioned, and with at least that physician monitoring after administration. And that is the only thing that it's on label for. So all the other stuff that we're seeing, so things like PTSD, all of the pain indications, people use it for diabetic neuropathy, for fibromyalgia, for complex regional pain syndrome, or just general chronic pain. Even people have back pain that are refractory or nothing else is working and they're stuck with no options. I mean, they're trying ketamine. All of that is off-label, which means the FDA has not deemed it safe, and they have not deemed it effective. It doesn't mean it's unsafe or ineffective. It just means that it hasn't been reviewed. And sometimes that really doesn't matter. I mean, doctors do a lot of stuff that's not FDA approved. I mean, if someone has a head cold, we say go home and rest, drink a lot of fluids, and have some chicken soup or something. And none of that's on label with the FDA, right? But
Mom said do that.
yeah, we kind of know, okay, that's just part of it. But the reason why it's different with ketamine than other drugs is that ketamine has been classified as a dangerous drug. It's a controlled substance. So, I mean, ultimately, that's that's one of those scenarios where we probably need to pay more attention to it.
I see. I ended up Googling just to see nearby, like, how many, of the ketamine clinics I could find within the Columbus area and then kind of an Ohio area. And every single location I found, whether it was, again, in Columbus or extended out, they were all labeled as mental health clinics. None of them were labeled as pain clinics, which I imagine is because that's technically not the on-label use. In those particular clinics, are people going there for both mental health help as well as pain? Is there any proof to
Yes.
show that? Okay.
Yes, and that is happening. They're going to those clinics for both mental health and pain. And when you look in Google for IV or even oral or intranasal ketamine, I think they would probably all market themselves as mental health clinic because that's what the FDA label is for
Gotcha.
infusion outside the clinic. That's number one. Number two, if you are on label with the FDA, it is likely that you will have insurance coverage for it. In other words,
Okay.
the doctor will get paid, the patient will have less copay. If you do stuff that's off label, it ends up being a cash pay situation, which can be difficult for everybody, for the consumer, for the doctor to collect. Just from a business strategy standpoint, I would think labeling yourself as a mental health clinic would be a smart move. Now, I mentioned this chemical compound called norepinephrine that circulates in
Mhm.
our body, and ketamine increases that circulation as one of its mechanisms of action. That compound is low if you have depression. People that have depression tend to have lower circulating amounts of that in their bloodstream. People that have chronic pain have the same problem. So oftentimes pain and depression are uniquely tied together, and ketamine
Mhm.
offers an opportunity to help both of those things. But I will say practicing pain management day in and day out, if you have chronic pain and you've had it for a long time, I can almost
You're gonna
promise
have
you
to.
also have some depression and mental health issues.
That's fair.
And just a little side note, it's this is blowing up all over the country. Ketamine is, and
Mhm.
in France, I was at a conference, and they said that when someone comes in and they're actively suicidal, the protocol pretty much around the globe is to make sure someone's in the psych unit so they don't hurt themselves. Sometimes they have to have a mandatory 72-hour stay to let it dissipate. But in France, there was this clinic that was actually giving ketamine boluses inside the emergency room. And during those 20 minutes, when those patients are sort of in that phase where they're getting trippy, hallucinating, and all of that stuff, sometimes when they wake up from it, because it's almost like you're waking up from a nap,
Mhm.
that sensation or feeling of wanting to harm themselves has dissipated. And they said, hey, this might be a tool for emergency rooms to use for people that are actively
Interesting.
suicidal. I will say that our emergency rooms in Dayton have started using ketamine. They'll move to ketamine oftentimes before they move to opioids.
Mhm.
If someone's having, say, it's used a lot in migraine headaches right now. People that are really suffering, can't function, and all of that. A little burst of ketamine, not a huge dose, but just enough to break the headache, is becoming quite common here in Dayton, actually, in the emergency room setting as well.
So this is a topic the board has discussed. I know we've talked about this. The board's concerned about it. It's on the radar. We've discussed this in the Emerging Practice Trends Committee. What steps is the board considering taking to ensure safe practice in this area?
Well, the thing that the thing that's really important, just from a medical board standpoint, is that we don't do anything to harm access to treatments that people actually need. So we need to walk that fine line of safety and protection while still maintaining access. And there are some little things that we can do. We haven't formally done these things yet, but I know we're sort of discussing is to make sure that physicians are checking their ORs, the PDMP, because that gives us a snapshot of all the other drugs that they're on. That's number one. Number two, to make sure that there's at least some guidance or education on the safety aspect of ketamine, that best practice would be to monitor blood pressure, to monitor the heart rate, to monitor the oxygen saturation.
Mhm.
Best practices would be to administer it under physician supervision, especially if the doses are high. Now, if it's just a topical cream or a gel, that's a pretty low risk thing. I mean, it'd probably be fine to do that at home. But if you're doing like high dose oral or high dose intranasal, that
Mhm.
maybe they should be monitored. Just like it is on the FDA label, where it's done in a physician setting and they're monitored and then allowed to be discharged once that acute phase is past. I mean, I think those things would accomplish the goal of maintaining access while not having a chilling effect on delivering ketamine. Um, I don't think there's a lot of utility for ketamine for multiple uses in a day over and over again. I think that's where we can have some problematic issues considering how dangerous the drug can be. And plus, if someone's unsupervised at home and they're really suffering in pain, sometimes people think, hey, more is better, right? And so you end up
Absolutely.
taking a little bit more and not realizing it. And if you're actively hallucinating, it's hard for you as an individual to know that you're hallucinating, number one, to have that awareness,
Hmm.
and that can get scary, right? And you can kind of lose control without realizing you're losing control.
Right. That's a very good point. If a patient is considering this treatment, whether it be for, again, the FDA approved uses or because they've heard about the effectiveness for pain, what should they expect from an encounter with a provider?
So I think that's important to make sure that there's at least a blood pressure cuff on you before you start to take ketamine, to make sure you have one of those oxygen clips on your fingers. That's actually a very effective monitor because it shows
Mm,
your heart rate and your oxygen percentage. Those two are a minimum. Absolute minimum. If they do have EKG stickers on you, that could be helpful. That's how I do it when I do ketamine infusions. But honestly, as long as you have the blood pressure cuff and the pulse ox, at a minimum, that's important. Is to make sure to look around and see. I mean, I've seen screenshots and images of other clinics. Does it actually look like a medical facility, right? I mean, you have to make sure that there are people skilled to help you,
right.
because medical facilities typically have things like defibrillators. They typically have people on staff that know how to do CPR and
Exactly.
rescue
Right.
you. But you have to make sure, like, if you're just going to a place that has a bunch of recliners, you're like, okay, well, who's here? Who's monitoring me? What's the training? I think those are just basic things that you need.
My
Mhm.
last question, unless you have something else, is what message would you give to physicians or other advanced practice providers that have an interest in this treatment?
Yeah, so I think that it could be a very valuable treatment. I think as we're learning more, it could be a very helpful tool. The important thing is to try all of the standard FDA approved treatments first, and ketamine should be reserved for only those severe cases. Um, if you do it for mental health, which is the most common reason, following FDA labeling is perfect, because it's been through all the trials, it's been tested, it's
Mm,
been vetted. So if you just follow that algorithm and protocol, I think it's a great idea. I think it could be quite helpful. If you start to dabble into off-label use, and most of the time practitioners are doing that to try to help people that are suffering, and if that's what you're trying to do, I get that. That's great. You want to help people that you have tools that might be helpful for them. I think it's important to follow the stuff that we mentioned with monitoring the patient, to make sure you have staff or you yourself is on site, to help if there's a complication, to make sure you have a protocol on what happens if someone's becoming too disinhibited, or maybe they're hallucinating and starting to get violent, or some sort of issue. Like, what is your plan? To make sure that you have defibrillator access, that you have a plan to contact emergency services if something goes really sideways. And then I think if you do all of those things, I think you could realistically help people that are suffering with this treatment. I think the things happening in the media with some ketamine overdoses that are happening to just general people and even celebrities are really
mhm.
shining a light on it. It's really unfortunate that those situations have happened. Um, but it also does provide educational opportunity to prevent them from happening in the future. And I've noticed even physicians have been prosecuted for being involved in some of those cases,
Mhm.
which that's also unfortunate to see for the physician. But on the other hand, that stuff ends up in the news, and all of us doctors, that read stuff, see that, and
Right.
we all
Paying
know not
attention.
to take it lightly. Yeah, so you start paying attention.
We love bringing you episodes like this because trends often get talked about a lot, but they're not always accurately explained. We want you to be informed as patients and caregivers, but also as providers in the field. That includes understanding the benefits and risks of receiving ketamine treatment. If you're interested in doing some reading, I've included a link to the Journal of Medical Regulation article about ketamine we briefly discussed in the episode details. We hope you enjoyed this episode. Until next time. Thank you for listening to this episode of MedBoard Pulse from the State Medical Board. Special thanks to our guest and board member, Dr. Amol Soin. Your insight was invaluable to this conversation. For more information about the Medical Board, visit med.ohio.gov. You can also email questions or comments to communications@med.ohio.gov. And remember, the more you listen, the more you'll learn, the more you'll share.